Well, good morning everywhere you stay because this is an international webinar. Thanks to Professor Shin Ushiro, it is a great honor to welcome to you. Professor Shin Ushiro is a Deputy Director of the Kyushu University Hospital in Fukuoka, Japan, and recognized international leading expert in healthcare quality and patient safety. He serves on the board of the ISQA and on the executive board of the Japan Council for Quality Healthcare. And I'm sure that many of you know the work that he is doing in Japan and around the world because this is a common speaker in many forums, many conferences. So thank you so much, Sin, to share with us your knowledge, your time. And he is also further recognized through the iSquad Life Membership Award. And I'm very, very pleased to come him as an active member of our Action BetterCare. So thanks a lot for sharing with us this specific relevant topic for all of us. And please, when you are ready, the floor is yours.
Mhm.
Thank you.
Thank you. Thank you very much, Jose, for a heartfelt introduction for me. And hello, everyone, again. My name is Shin. I am a Deputy Director of Kyushu University Medical Center in charge of patient safety. And I also work in JQ, Japan Council for Quality Healthcare, which is an accreditation body in my country. And JQ is running not only accreditation but also national reporting and learning system and no fault based birth injury and learning system for cerebral palsy. Cerebral palsy is the pathological state of brain damage and so on. So I am really honored and privileged to be invited to the member of Cost of Better Care working group, and because I know that my country got an aging society earlier than other countries. So, for that reason, we have a lot of experience of providing not only medical care but also nursing care for the elderly and the disabled person and the disabled child. With those experience, I am happy to contribute committed to the research progress of working group of the Better Care team. So today I produced 40 presentation slide, and I am happy to share with you all my presentation slides soon after this session. And I have a lot more presentation slide to be very honest with you. So I am, of course, I'm really happy to share all of them with you for your reference. That's the way I contribute to the group, working group of cost of better care initiatives. So I'd like to start my presentation. So let me share my my slide show. Okay, Jose, can you see my
Yes,
slide
yes.
big
Uh,
enough?
yes, perfect. It's working.
Okay.
Thank you.
Yeah, thank you very much. And I'd like to move forward to the next slide. Is it moving?
Yes, it is.
Okay, thank you. Thank you very much. So thank you very much. So uh, on this valid occasion, I'd like to talk about the development of healthcare system, not only medical care but also nursing care system in my country to provide better care, as in our group name for the elderly people or disabled people who are taken care of at home. I'd like to start off this slide. This is the trajectory of our demographic change. And maybe you have at least two observations. One is total population is rapidly shrinking. Now we are at 2026 around here. Now the population began to shrink a couple of years before, but it will predicted to decline more rapidly in years to come. And the second observation is that when we look at the breakdown of by age group, the it's not proportionate, and the age group at the age 65 and older, 65 and older is not growing, but it's all the population is almost the same. But the younger population is rapidly shrinking like this. Okay, so now we have population aged 65 and older uh, uh, with at 29.4%. I think this percentage is much more than that of other countries. And we predict that this rate will increase more in years to come. So the challenge in my country is that we need to cope with this rapid change of population and the rapid change of the breakdown of aged group. And back in 1945, the World War II ended. And after that, in order to build robust healthcare delivery system, particularly medical care delivery system, my country developed a facility. It means just building the hospital, building this clinic, and we developed human resources like physician, nurses, dentists, pharmacists, etc., etc. And in 1961, we launched a medical care insurance system that was really helpful to achieve universal health coverage. But after that, during the decades afterwards, we got aware of the necessity of nursing care services. So we launched the nursing care insurance system in the year of 2000. I will touch on the history in the next slide and onward a little bit. And after that, we developed the facility and human resources as we did for medical care delivery system. And at present, in the year of 2025, 2026, the challenge is to redesigning and reallocation of resources to optimize decades-long care delivery system, considering total population decline, as I said in earlier on, and the rapid aging, as I also touched on in the previous slide. And the key word is aging of the elderly. It means that expansion of the elderly population aged 85 or older is very much highlighted in 2025. So the people at the age of 65 is defined as all the elderly people in my country. However, now 65 is probably young. We need to focus on the population at the age of 85 and older because the population is still growing, although total population is declining. And here you see the statistics of the development of our medical care delivery system, population, institutions, and number of professionals. The most of those the professions are licensed by the central government. And here you see the medical care insurance system. Briefly, all the people, all the residents in my countries are insured. And then we need to pay insurance premiums from our monthly salary. And when we visit hospital or clinic and receive medical service, we need to pay co-payment, mostly 10%. And if you are very rich, you need to, I'm sorry, mostly 30%. And if you do not have a lot of income on monthly basis, you just pay 10%. And the other 70% comes from the insurance system through the reviewing system. This is our system established in 1961. But as I said, after that, in 1969, the Ministry of Health issued a white paper raising questions over long-lying elderly people. And in the year of 1972, a very famous novelist, Miss Sawako Ariyoshi, published her novel, and she depicted the life of senile dementia and family members who take care of the affected the elderly. So the Japanese society quickly got aware of the heavy burden heavy burden of senile dementia on the family life. And in 1990s, Dr. Fumio Yamazaki published his essay raising a question saying that dying in hospital, what does it mean to our life? He, as a medical doctor, wondered if the hospital is the best place for the elderly people or disabled people to spend the last days of their lives. Maybe he thought there are people who shouldn't be hospitalized very long and who should be returned to their home to live happy days, happy month in their lives. So, as I said, in the year of 2000, we launched the nursing care insurance system, which mimics the system of medical care insurance system. All the people, working people at the age of 40 and older have to pay insurance premiums. And if we receive nursing care from nursing care facility or clinic or hospital, we normally pay 10%, and another 90% comes from the insurance system through reviewing system. This is how this system works. And we concurrently we developed human resources and of course the facilities as well. And the red asterisk is are professionals licensed by the central government, and the blue double asterisk corresponds to prefectural certification. Prefecture is sort of a jurisdiction unit in my country. There are 49 jurisdictions, including Tokyo district in my country. And what you see here is the trajectory of expenditure of nursing care and nursing care and medical care. The blue bar corresponds to medical care, while orange bar corresponds to nursing care. We have been observing that rapid expansion of nursing care expenditure, as you can imagine. Well, this is a very complicated slide, but this is a quotation from the government slide to emphasize that it's necessary for my country to integrate all kinds of care, such as medical care, nursing care, and welfare services. And what this slide tells about is that the elderly people at the center here receive uh, home visit medical care, dental care from hospital or clinic, and they get medicine from the community pharmacy, and they often get home visit nursing care. They might be admitted to hospital or they might be admitted to nursing care facilities when they feel sick or when they suffer frailty of their body. But if after the recovery they get back home and continue to get home visit care or home visit nursing care. So medical care delivery system and the nursing care delivery system have been developed independently. In other words, those delivery systems are fragmented. That was the reality in my country. But now the elderly people receives all kinds of care. So the government is now emphasizing that we need to integrate all kinds of care. And for that purpose, based on the Nursing Care Act, the government launched the Regional Inclusive Health Support Center, which provides a wide variety of support, not only to medical or healthcare professionals, but also to residents and family members. And the government also facilitate medical professionals to launch consultation office. And the consultation office is for the healthcare experts, and it's very frequently run by a regional office of Japan Medical Association, which is a physicians association, and they are very rich and they are very politically influential. So they are appointed to operate the consultation office, and the office hold regional board joined by medical care and nursing care providers. And the office also provide consultation service and education and training for experts for medical and nursing carers. Well, and I'd like to get a little bit deeper dive into Regional Inclusive Healthcare Support Center. In previous slide, I said that this center provides a wide range of services. It is those services are shown here. It provides inclusive consultation initiatives, consultation service, and number two, human rights protection initiative, because the elderly people very often the human rights of the elderly people are very often compromised in many occasions. So this center provides human rights protection service. And the number three, level one, frail prevention support initiative. Level one is a very mild and very slight level of frailty of the elderly, almost healthy. And those elderlies could return to the level zero. It means no frailty. So the prevention service is quite important, provided by this center. And it also provides inclusive and constant care management initiatives in close communication with care professionals and family members. And it also hold regional integrated care meetings, um, joined by not only healthcare professionals but also families. Now we have more than 5,000 centers based on the Nursing Care Act in my country. And in each center, social welfare worker, public health nurse, and chief nursing care specialist are deployed. And here you see the video of one of the health support center based in Hakodate in Hokkaido, Japan. And the center says that the population of the aged people is rapidly growing in Hakodate region in Hokkaido, Japan. It's a northest part of Japan. And looking after the elderly living alone is increasingly important so that they would live with a sense of security and ease. So the center staff emphasize that please inform center staff if you notice the following observation on the elderly people or disabled people. The elderly neighbor is not seen recently. So if you do not see the elderly people, please, you notice the center staff of that. And the newspapers piles up in the mailbox, meaning that the elderly people is not taking the newspapers on daily basis. So if that is the case, you notice the center staff of that, and the elderly people looks a little bit different from he or she used to do. If that is the case, you notice the staff of it. And I mentioned the level one level of the frailty. We have introduced a group system of the frailty. It is from 1 to 5. 5 is the severe frailty. 1 is very mild. And please note that the care plan is devised according to the care levels. And if the elderly people are rated as 1 or 2, they are just suffering the mild frailty, so they could return to level 0. So the care plan has to be devised so that they would return to the healthy elderly again. So this is the grading system. And I'm sorry, there are a lot of local language, but in the next slide, I will show you the English translation. So the Japanese government is now trying to promote the national healthcare data platform. So healthcare data has been developed, has been saved separately over the last decade. So now the Japanese government is trying to integrate all kinds of healthcare data through one platform called My Number portal site. We Japanese people likes to shorten the word. In other words, abbreviation. So we call the portal site not My Number, but minor portal site. And what we integrate is medical care data and nursing care data and public health, social welfare database, etc., etc. For seamless data sharing in continuum of care. Number two, efficient provision of public service, better advice with integrated data through minor portal, and the research use of data for public health, medicine, healthcare industry advancement. So this integrated data is supposed to be shared with the industry for innovative drug development or medical device development. Okay, and coming back to the nursing care, what you see here is the types of comprehensive nursing care services. I'm sorry again, this is very complicated slide, but please look at the upper half of this slide, which corresponds to nursing care service, and the lower half tells about preventive nursing care services, which looks like the nursing care service in the upper half. And we provide a home-based nursing care service, such as visit service, day service, short stay service. In any service, the elderly people or disabled people stays at home or come back at home at night or come back a couple of days later to their home. And we also provide a facility-based service in various type of facilities shown here. And we also provide a community needs-based nursing care service, which is provided based on very close relationship of the carer and the elderly or disabled people. For instance, night visit nursing care. What we do in night visit nursing care is that, hello, Mr. Ushiro, it's 6 or 7 p.m. today. Did you eat your dinner? Did you wash the plate? And you should be careful of the leakage of gas after cooking, or did you took a bath, etc., etc. We provide those types of very meticulous care in our nursing care insurance system. And now the Japanese government is defined four explicit roles to home care, such as discharge consultation and assistance, number two, daily care, number three, end of life care, and number four, acute care, so that the elderly or disabled people would stay at home if they like, until the end, until the last minute of their lives, to live happy life. And I'd like to explain a little bit more about the discharge consultation and assistance. We know through through government survey that elderly people want to stay in hospital as long as they can, because if they are discharged, they are afraid that they may not be accepted by the hospitals again, so they may suffer at home. This discharge consultation and assistance address that anxiety of the elderly people. And then the home care service tells the elderly people that you should discharge from the hospital because you are recovered well. But if you feel sick or you suffer frailty, hospital accept you anytime. And the hospital accept the elderly people through acute care. And daily care is daily care to maintain the health well-being of the elderly people. And the end of life care is what you all know very well. And I'd like to show you this funny slide. What you see here is the price list book of medical care insurance. We also have the similar book for nursing care insurance system. It is more than 2,000 pages, and the thousands of items is defined in the book. And the prerequisite or precondition to get the item, to get the fee described in this book. Very complicated. And the medical care insurance price book includes items for home care. And of course, nursing care book includes home care items, etc., etc. You might be overwhelmed by the complexity or details of this book, but don't worry. What we need is just 100 or several hundred items out of thousands of items. We get quickly familiar with those items and preconditions. And my funny joke I like is that Japanese people is really funny people because we they like to make things very detailed, and at the end of the day, they are confused by the complexity they created. It is happening in my country. Very funny. Okay, looking at the nursing care price list, here you see the brown square and green square, which are items described and defined in nursing care price list book. And here you see nursing care facility and the medical institution like hospital and home. And let's say that the elderly people discharge from nursing care facility to return home, and the medical institution helps the life in nursing care facility and the home life at home. And In the next slide, this slide, I'd like to focus on this part, these items. Uh, the- uh, you will get extra fee. You will get more money when a patient is discharged from nursing care facility to return home. If you consult with hospital staff and nursing care staff for the home care of the elderly people, in a nutshell, consultation or close communication between two facilities will make more money for your institution. And if you look at this green part, you will get extra fee when you share the data or the clinical course of the elderly with doctors in charge of home care. You will get more money. And if you share medication data with physicians, you will get more money. So all in this way, um, two different insurance systems were developed independently, but now they are working collaboratively to promote collaboration of different care settings, such as nursing care and medical care. And in 2021, in relation to safety and quality in nursing care facilities, the Japanese government launched extra fee system for safety system equipment, which is good. But at the same time, the Japanese government is launched a tricky system, fee reduction system for no safety system, or fee reduction system for failed safety system in revised nursing care insurance price list. So, if your facility has no safety system or failed safety system, you will lose money. That's the way it works. And well, here you see the here you see how the nursing care insurance budget is spent. Uh, the most important purpose for which the nursing care budget is spent is a nursing care benefit or nursing care service for the elderly people at level 1 to 5. And but please look at this part, the bottom one. So nursing care budget could also be spent for voluntary initiatives, including family caregiver support program. So it's called voluntary initiative because if the municipality do not have a lot of budget of nursing care insurance, the municipality cannot spend the money for voluntary initiatives. But in most municipalities in my country, this voluntary initiatives is now running because this initiative, in other words, family care support program, is quite important. So I'd like to take a little bit deeper dive into the family caregivers support program. The program provides the program hosts nursing care class. It's sort of a school aiming to maintain or improve health condition of family member receiving nursing care insurance benefit. So the informal caregiver come to the school and learn how to take care of their family members. And it runs initiatives of monitoring senile dementia patient while fostering enable conditions. So senile dementia is a growing concern in my country. So this issue is really focused. And the program invites experienced family caregivers, and those family caregivers gives instruction to new family members who have just begun nursing care for their family members. Or this initiatives provides small amounts of money as a reward for nursing care to encourage informal caregivers to continue nursing care for the elderly people or disabled people at home. And this initiative includes health consultation, disease prevention services, and hosting network events for family caregivers to make friends each other in the same situation. And it promotes initiatives to foster independence in nursing care recipients. So, in order to make the elderly people relatively independent or fully independent, informal caregiver has to provide very good and high quality nursing care. So in order to encourage those informal caregivers, this initiative provide benefit money for as a reward for consolation, or this initiative provides nursing care products like diaper or urinary catheter free of charge. And what you see here is the just example of class or videos of education and training, which is provided this initiative. And well, this is the class joined by experienced family caregiver to learn about the care, nursing care for the elderly people, etc., etc. We even invite dementia person if the dementia is mild, and share their experience with informal caregivers. So I'd like to emphasize that even dementia person can teach the informal caregivers in the class like this. Okay, I have talked about the nursing care insurance system and medical care insurance system so far, and with this slide, I'd like to emphasize another budget related to nursing care and integration care. So according to the government legislation related to the integration of care, integration of medical care and the nursing care, the government every year government provides the fund called Regional Medical and Nursing Care Integration Fund. This fund stays in 49 prefectures, and care providers such as medical institutions, nursing care service delivery offices, or NGOs applies to the funds, and the funds at prefectural level reviews the apply, and if the application meets their criteria, they quickly fund to the forefront of healthcare. If the central government provide those funds, it takes month. It takes very long. So for the quick response, the government place or provides the regional medical and nursing care integration fund at prefectural level every year. So with this fund, if your application is related to home care delivery, you will get money quickly from prefecture. And if it is related to recruiting human resources for medical care or nursing care, for integrated care, you will quickly get money from the fund. This is how this fund works. Of course, this fund could be spent for research purposes, like the development of robot for nursing care. And the robot is now being developed not only by the regional fund, but also on commercial basis. Well, with this slide and the next slide, I'd like to touch on reporting and learning system on nursing care. But Looking back at the year of 2000, when the nursing care insurance system was first launched in my country, there was no safety measures or guidelines for the nursing care facilities. But mid 2000, physical restraint and abuse of the elderly were two topics very much highlighted in my country. And the Elderly Abuse Prevention Act was enacted, and the Nursing Care Act was revised so that the facility would have guidance or safety division, etc., etc. And the year of 2010 and around, the nursing care system introduced the knowledge and expertise and practices from medical care delivery system, such as reporting and learning system, etc., etc. In this system, the incident case which happens in nursing care facility is reported to insurers or payers, which is municipalities. It's a local government. And in the year of 2010 and early 2020s, the guideline on incident prevention at the nursing care facility was published by the ministry, and it was revised, and it was revised so far. And in recent years, policy on care for senile dementia based on Dementia Care Act was launched by the government. But there is a problem. These newspaper articles emphasize that through the survey conducted by Nikkei newspaper companies, the survey concluded that nearly 50% of municipalities do not analyze the incident report. They only collected incident report, but just report piling up. There is no analysis. So this newspaper report emphasizes that safety in nursing care delivery still need improvement. And at this point, I would like to share with my role, my mission in one of my workplace, which is accreditation body in Tokyo, in my country. And I have been in charge of national reporting and learning system for hospital and clinic since 2004, and community pharmacy since 2008, and dental clinic since 2023. All those system or all those reports are happening in this integration of all kinds of care. So what we are lacking is the instant report learning system from nursing care facilities. And our new fiscal year will begin next month, April, and the government is now has a new budget proposal in the new budget for the next fiscal year 2026 related to the launch of database of nursing care incident, which has been piling up in municipality government. And the government is now thinking of the tabulation, analysis, education, and the training at the prefectural level, and at the tabulation and analysis, and produce statistics and the nursing care incident report case study at the national level in this new budget. But please note that discussion continue about who we run the database and manage the data, including reporting. This discussion is still underway. But there is very interesting news. Today, a couple of hours ago, the Ministry of Health emailed to me saying that one of the division in charge of this database wants to meet JQ and my division and myself. Probably they will ask JQ about running this database. Well, this is a news which has just arrived, so no Japanese people know about this news. So you are the person who earliest learned about this news. Well, last but not the least, I would like to go a couple of slides very briefly. I just briefly touch on end of life care. The Japanese government launched the guideline on end of life care, and they produced the decision making chart in case that the elderly people expressed their will or preferences for the last couple of months or last days of their life, or in another case that elderly people doesn't express their willingness. And the the Japanese government also produced a manga cartoon like this for better understanding of the decision making between the elderly people and the informal caregiver and healthcare professionals to reach agreement before the elderly people gets in very terminally ill. Okay, what you see here is the synthesis of my talk. I'd like to skip this synthesis in the interest of time, but I'm happy to share all of my presentation later on after this session. So thank you very much. I would like to pass over to you, Jose. Thank you very much.
Thank you so much. It's
Thank
perfect
you.
because your description of the challenge in Japan and the manner in which you are addressing this situation is a very good route for many of us, because
Thank
at
you.
least in Europe, as you know, we have not the same, but we are in the same route in
Mm,
terms of the elderly of our population, and
mm,
Italy and Spain particularly are
mhm.
in the top of the
I
European
see.
countries challenge this
Mhm,
new situation.
mhm,
And it's very good to know new news today.
mhm.
That's funny.
Yes.
But at the same time, to know more about how you are organizing
Mhm,
the system. And it's very curious because, to my best knowledge, it's the
mhm,
first time that I know that the government prefecture, the structure, is
mhm,
funding what
mhm,
happened after leaving the hospital to
mhm,
ensure that people are
mhm,
receiving the right care. So,
mhm,
congratulations for your
mhm.
presentation and
Thank
for
you
the
very
work
much.
that you are doing in Japan. So, it's a very good point for better care and for our countries. So there are many applause on the chat, but
Thank you. Thank you.
also
Thank you very much. Thank you very much.
some questions and some reflections.
Yes.
Our
Yeah, I'm
colleague
happy to.
from
Yeah.
Portugal, but please, you can connect your micro and ask directly to Professor Ushiro. But
Mhm,
for example, Raul and Anupopa, Raul from Portugal and Anupoma from Austria, are thinking what happened the hour after leaving the hospital. And when you arrive home, because this is a very, very challenging situation in many,
mhm,
many countries and
yeah,
for many people. So
mhm,
this is the first point. And they are asking specifically what happened with people that are not sick, because in case or a disease or a specific condition,
mhm,
that nursing, for example, visiting you at home because you
mhm,
need something is clear. But what happened
mhm,
in when you are living at home
mhm. Living
and
at
you
home.
need something? What is
Mhm,
the what? Well, in any case, this is the point, and if
mhm,
you can explain, we
mhm.
appreciate.
Thank you. Thank you very much. If you are healthy at home at the age of 65 or 70 or 80, you will get a pension from the government, and you will live happy life or healthy life. But if you feel very alone, or if you suffer solitude, the government subsidizes regional or community-based NGO to that take care of the lonely elderly people, to invite them to a local community for chatting or for playing some athletic games, etc., etc. So that's the way you live when you are healthy, healthy elderly people.
Yeah, yeah, yeah. Anupoma also is
Yes.
well introducing a
Yeah.
reflection about the budget that is needed
Mhm.
to address
Mhm.
the current challenge of our elderly people. And really, as you suggested, Shin, I think that we need to think in a different manner because we
Mhm.
need to activate community resources, simple solutions, and not only recurring to the traditional response. But Anupoma, I don't know if you want to open your micro and make a questions or
Mhm.
uh, meanwhile, Vanessa from Brazil is suggesting that the Better at Home program in Brazil is also addressing this problem. So it's good, and it's good to know more in other regions what is
Mhm.
possible to do. And Upoma also asking you directly if there is any automatic response to analyze the incidents, or is what is the system that you are using in this case with the database that you have described?
Mhm. Mhm. Okay. Thank you very much. The in JQ, Japan Council for Quality Healthcare, we have been running national incident reporting system, and we have analyzed incidents reported from medical institutions such as hospital and a small number of clinics so far, and we have skilled staff with experience of a couple of analytical method like root cause analysis and etc. etc. And we publish thematic analysis and a numeric analysis such as just table or pie chart. And we publish quarterly report and annual report and monthly alert, and we also provide a database of incident cases. So with that knowledge, maybe we will apply the similar procedure to the analysis of the incident report from the nursing care facilities. But the care environment is quite different in nursing care facilities from medical care facilities. For instance, I'm working in university medical center, which provides advanced care, and there are a lot of medical staffs, and the disease is really acute and very serious, but it never happens in nursing care facilities. So we need to consider that, and we need to invite experts on nursing care facilities for our safety analysis. But it is said that there are not many experts on safety in nursing care facilities, according to our communication with the government. So we need to develop human resources to have experts on nursing care. I hope I answered
Oh,
this
sure. Yes, yes,
works well.
yes.
Yeah,
Thank
thank
you.
you.
Thank you.
Thank
We have
you.
four more questions. First,
Yes.
Jian Tian Su
Mhm.
is asking about the shortage of medical professional, but please, Jian, if
Ah,
you can connect your micro and ask directly to him. Yes,
Yeah, yeah,
please.
yeah, yeah. Thank you,
thank you.
Professor.
Thank
Thank
you.
you for your
Thank you.
brilliant presentation. I really enjoy it.
Thank you.
Yeah, I studied in Tokyo before, so I think Japan has the shortage of the medical professionals. Why?
Mhm.
Because just in 2025, last year, Japan government raised the medical payment percentage for the
Mhm.
people who are older than 75
Mhm.
from 10% to 20%. So
Mhm.
I think that signals that the Japan government had a shortage of the funding. But
Mhm.
my Japanese friend told me the real reason is the shortage of the caregiver, both
Mhm.
professional and informal. Because if you have the shortage of the caregiver, the only solution is to raise the number in those professionals. That's number one. I hope I can have your opinion from you on whether you think there's a shortage of professional and informal caregiver for the elderly people. And the second question is, I want to know whether you think recruiting the foreign caregiver is the solution or not, and why. Because in Japan, you open the foreign people who can provide the medical service. There's a special visa because I live in Japan for several periods of time. So there's a special visa, but it opens to certain jobs. Medical is one. So I want to know your opinion on whether you think that's the solution. And finally, the third one, which is the most important one. Because in Japan, I did some interview with the ministry officials. I think it's very difficult to persuade them to change the mind. So what's your strategy on engaging with the talks with the ministry officials or politicians? Thank you. Again, thanks for your brilliant presentation.
Okay, thank you very much, Jen Tian, for your questions. And I admit that you know very well about the current status of what we are suffering in my country. And as you told, this year, the Japanese government will increase, I would say dramatically increase compared to the increase in the past, the healthcare budget, because in previous couple of years, we saw the professional nursing carers leaving their jobs because their salary stalled, the salary remains low in spite of inflation. So the Japanese government tried to increase their salaries. I'm talking about the salary of particularly nursing care, professional nursing caregiver. And I'm working in University Medical Center, and I'm a physician. And we are also suffering from the low salary, particularly in physician in University Medical Center heavily suffers low salary. But the Japanese government also fund the medical care to increase our salary. That's one of the strategy the government is now taking to retain the professionals, nursing care professionals, as well as medical care professionals in their workplaces. But at the same time, it is predicted that we are in seriously a shortage of caregivers, particularly in nursing care industry. So the inviting foreign carer is one of the options. Maybe the government will promote it. And another thing we are suffering is the disproportionate distribution of those carers and physician nurses, etc., etc. I live in a big city in my country called Fukuoka, and I also work in Tokyo. There are many healthcare professionals, young healthcare professionals in those big cities. But if I go to rural area, they are really suffering from shortage of those professionals. So now the Japanese government is trying to address this proportionate distribution by introducing a new regulation or mandate particularly for physicians to stay in rural area at least a couple of years when they are young, so that in order for them to be the manager or healthcare director of institutions in the future. So if you want to be a director of the hospital, you need to spend a couple of years in rural area in my country. If you do not want to be a director, you don't need to do that. I don't know if this strategy works well. Maybe there are a lot of opposition on this strategy, but the government is now try to launch this strategy. So in a nutshell, we are now tackling on this issue that what you described. So thank you very much.
Yes, thank you. Sorry, thank you, Shin, because I go surprise by surprise because really it's the first time that also I heard about this policy to
Yeah.
promote. But really, behind these words is a common challenge as well in terms of the
Mhm.
shortage of professional. This is
Yeah.
it's not specifically in Japan, as you know.
Mhm.
It's also a very common problem for many of us, and particularly in Europe, we have also a great challenge in this sense. So
Mhm.
today we are talking about what is possible to do because both are relevant aspects. So Anupama, the floor is yours to make a question. Thank you so much.
Mhm.
Thank you, Jose. Thank you,
Thank you.
Professor, for the fantastic presentation, first of
Thank you very
all,
much.
and the explanation, because from afar, Japan always looks maybe different, and the complexities are not so apparent to the outside eyes. So thank you very much for that. Learned a lot from some of the strategies the Japanese government is taking. So I asked this question in the chat also, but maybe explain myself a little bit when I'm talking about automation. So when we think about Japan, we think about fantastic technology and technology adapters as well at the community level, right? So I was wondering if you were in the process, maybe you already have it, or maybe you have it in the plan of automation of these incidents reports and then response. Do you, in any of the community within Japan, have a system installed already where an incident report, when it comes, it is analyzed automatically, like what happened and what kind of error or problem happened, and then sent to maybe somewhere else to get an automatic response to mitigate this situation. So it's like an emergency call. Yeah. Somebody is sick, we call 911 and somebody comes and takes care of the situation, right? So I'm imagining a system like that where in home care, something happens, we have an incident report generated from there, maybe by the family, maybe by the home care professional or nurse who's visiting, and then it goes through the system, triggering a response. Do you have anything like that at the community level that we can study from? That's one. And the second question, sorry, a second question is, I just searched and looked at the unemployment level in Japan. It is a little less than 2 million right now. Do you have any collaboration between the health ministry and the labor ministry to kind of connect this 20% increased budget to train people who are unemployed as healthcare professionals?
Okay, thank you.
Oh, yeah,
Thank
thank you. Thank you very much for your two questions. And in relation to your the first question, what do we have, particularly what we have in terms of uh, technology, we only have the electronic incident reporting system in not all, but a part of hospital or clinic or nursing care facilities, depending on the institution. And at the national level, we have developed a electronic reporting system in JQ, which was funded by the government. And those two systems are mostly integrated. In other words, the item to fill in is the same, and just press the button and it goes from the facility to JQ. But there are other facilities who are now running the system on paper, on documentary basis. So that's the situation. Of course, I agree with you that we need to introduce more innovative technology for the incident reporting and learning to swiftly respond to the risk which is happening in home care or facility care. And yes, that's one thing. And thank you for the second question related to the unemployed person and labor policy and healthcare policy. So in my country, the Minister of Health and the Minister of Labor emerged 20 years ago. So the name of the ministry is now Health, Labor and Welfare, Minister of Health, Labor and Welfare. So those two different ministries is now in the same ministry, collaborating each other. Of course, we need to invite the people who have no jobs to healthcare industries through education or subsidy or benefit, etc., etc. But I'm not sure of the actual implementation of the education or the subsidy or the benefit for those people because most people likes to have a job with a higher salary, and the healthcare professionals are paid from the budget of medical care insurance and nursing care insurance. Both of them are public. In other words, cheap system. I don't know if there is for implementation and successful implementation of the policy by the government. Okay, thank you very much.
Thank you so much. So,
Thank you.
Reinhard Strameth is the business chair,
Oh,
the
okay.
side of BetterCare. You know him.
Yes,
So,
yes.
please, Reinhard, you have the floor is yours for your question. Thank you.
Thank you.
Thank you. Konbanwa, Shin. Good evening, Shin. So
Oh,
thank you very much for having the lecture. I know it's 10 o'clock
guten
in Japan
Nacht.
right now. Yeah. So thank you very much for your dedication. We talked about long working hours of doctors, and you definitely had an extra shift for us. So arigatou gozaimasu. Thank you very much.
Thank you.
I have one question that I think kind of relates to Anupoma's question, because I recently learned in Japan, due to the demographic shift, it's now mandatory to at least try to employ people up to the age of 70 years. So the retirement age raised from 60 to 65 within a couple of years. And now, if I'm correct, please correct me if I'm wrong, it should be at least, you should at least try to employ people until the age of 70. So the whole policy of this people sitting at the window, the Marugiwa Zoku, is of course questioned because it's not financially sustainable anymore. And but with all that, do you think, what will be the prediction? I think Japan is a good forecast of what will happen in Europe. Now they're discussing retirement at the age of 60 instead of 65. And I think it should go the other way around, as we have more healthy living years. And in Germany, they try to discuss about a social year for everybody in the first year of retirement. And of course, everybody was furious because they said, I'm retired now, and now everybody else has to pay for me. So from a society that is very collectivistic, and I really admire that from the German point of view, what do you think will be really sustainable measures to keep the system stable, with all respect? Because from the demographic change and the economic perspective, you already mentioned it's a cheap system under pressure, because only few young people pay in a system with many old people. So it's simple mathematics. What do you think would be sustainable measures that Japan will take in the next years? Because this is what we maybe have to take in 3 or 4 years later than you do.
Mhm. Okay, thank you very much. And financial sustainability in healthcare system is quite important and very much highlighted currently in our society. And I don't see any big discussion on having earlier retiring age, like 55 or age like that. And currently, the government mandate is that the employer need to have their employees until the age of 60. But most workplaces have their staff until the age of 65, and the government is now facilitating the many workplaces to have those staff until the age of 70. And we are allowed to get a pension from the government from the age of 65 or 70. We have two options. If you get the pension at the age of 65 and older, you will get a little bit less money. But if you get from 70, you will get a little bit more money. That's a strategy. In my workplace, nurses has to retire at the age of 60, 60. But a professor is allowed to stay in until 65. But nobody is allowed to stay here in 70. And in private companies, uh, those companies are now following the government guidance or instructions to have their staff until 65 or hopefully 70. But at the age of 55 or older, there is no promotion. The divisional manager or a director of the bureau, etc., etc. There is no promotion after 55. If you are very good position at the age of 55, there is small number of people in that situation. However, but if you are in a very high position at the age of 55, you still continue to promote, but others are not allowed. So that is how it is working in my country. And so, in a nutshell, for sustainability, we believe that we need to work longer than we work today.
Thank you.
Thank
Really,
you.
it's a
Thank you.
pleasure to talk with you, Sim, but as Reinhard says, it's too late for you. So there is time only for two more questions. The first,
Okay.
I think that you don't need any introduction to Paulo Sousa. So he's here and he's ready to make a question. So please, Paulo.
Thank you very much, Jose. Well, it's not a question, it's more a comment. Well, first of all, I'd like to congratulate Professor Shin
Thank
for
you.
the excellent presentation,
Thank you very much. Really honored.
Yeah, your presentation allow us to understand how home care and nursing home service are organized and operate in Japan. But perhaps what impressed me most were the financial incentives encouraging patients to return to home care and to nursing care, and above all, the incentives to promote and ensure safety care and safe environment. And that is something we must learn from, and I am sure to introduce here in Portugal and in Europe. So, as I said at the beginning, it was just a comment. It's always good to hear from you, Shin,
Yes.
and congratulate you for this outstanding presentation. Okay,
Thank you.
very much.
Thank you very much. Yeah, thank you very much, Paolo, for kind words. Thank you very much.
And thank you, Jose.
Thank you so much. Well, the last question is from Barbara Kutriba from Poland, because she says that the micro doesn't work. So she is interested in know more about the long working hours of doctors, the system that you are using in Japan. So please see if you can explain some details about this system. We appreciate.
Okay. Thank you very much. And so our medical care system was has been really good. One of the reason is long working hours of physicians, and as a physician, I was told I have been told that it's it's uh, it's natural that Japanese physicians work very long for patient and their families, but we observed occasionally the sudden death of a physician who worked very long before a couple of months before the death, etc., etc. As so the 2 years ago, the Japanese government finally launched the regulation on physicians' long working hours regulation. But if reduce the working hours to the average level, medical care cannot be delivered to the patient. The government took the step-by-step approach. So every year we need to submit the plan to reduce working hours to the local authority of the Ministry of Health, Labor, and Welfare. And if it is approved by the authority, we work along with the plan. And the next year, we assess what we did in previous year, and we propose the next plan to reduce more our working hours. So it will take until 2035. It will take 10 years to reduce physicians' working hours to the average level. But as you see in today's discussion, we are suffering from the shortage of healthcare professionals, particularly in rural area. So most physicians are skeptical about the implication of the new regulation on working hours. But it has just begun 2 years ago, so we will see what will happen. So that's the status quo on working hours in my country.
Okay.
Yes.
Thank you. Barbara is thanking you for your response and your description of the system. We have, I am sure, some other questions, but it's too late in Japan. And Upoma, I read your comments on the chat about some strategies to reduce the shortage of professionals, specifically in the area of nursing. I don't know if you want to comment something on Upoma, but a brief comment because it's too late in Japan, and
Thank you.
we appreciate very much the time, dedication of Professor Ushiro to us, but at the same time, we must recognize that it's too late. So,
Yeah.
Thank you. Thank you.
Yeah,
It's okay. No worry.
very quickly, two strategies. One strategy that worked also in developing countries with very low budget. So picking some people from the community, train them as care professionals, nurses, or depending on their education level, trained as care professionals, and then give them the job to provide care in that community. So you pick up from the community, keep them in the community, you just give them a salaried job. That is one strategy. Another strategy is 4 year, 5 year, 6 year study of nursing sometimes is very difficult and not always needed. Like for home care, who are just living, are not sick. Elderly people, but not sick, do need, but also need daily care. So training nurses with 6 months, 1 year, 2 year, 3 year, with different certification and different set of tasks which they are allowed to do. So making it easier to get into the care industry, but they always can improve themselves with more training and so. So these are two strategies. I was just wondering, do you already do this in Japan? Or could we maybe do a pilot with Japan with collaboration with BetterCare? Yeah.
Okay, thank you very much. I think that we are still the government is struggling with having the people who is not working to healthcare industry because their parents is has a uh, has some amount of money, so they are not suffering from poverty. So they just stay at home and playing computer game and no job, etc., etc. So it is quite difficult for inviting for us to invite them to healthcare industry. That's one of my thoughts. And another thing is that yes, the healthy elderly people is increasing. You are right. I admitted that. So I see growing willingness of the elderly people, particularly at their 70s, late 60s or 70s. I believe that they will work to some extent to contribute to the wellness of the society. I think we can count on them. Thank you very much.
Thank you so much to all. As you can see, my appreciate colleagues from BetterCare to come with Professor Ushiro is a guarantee of success. And today, he described a very interesting experience and also a very interesting approach for all of us. And I want to say thank you so much for your excellent presentation and for this debate. So thank you so much for all, and thank you so much, Professor Lucero, for your collaboration with this action. So thank you and bye. Thank you.
Thank you very much.
Thank you,
for having me.
Professor, for
Thank you.
staying
Thank you.
awake.
Yeah, see you in person soon. Thank
Have a
you.
very good night's sleep.
Thank you very much. Bye bye.
Bye. Bye-bye.
Okay.